Hello friends, I am Doctor Ravindra Nikalji. I am consultant nephrologist and transplant physician at Apollo Hospital, Navi, Mumbai and Apex Kidney Care in Vashi. Today I am going to speak to you about diabetes and kidney disease. You all know, probably all of you know that diabetes is very common in India, and India is becoming a world capital for diabetes. And because the diabetes is so common, the complications associated with diabetes are also on the rise, and chronic kidney disease, or which is also called as a chronic renal failure, is #1 killer in patients suffering from diabetes. So it is very important to understand how to take care of your kidneys for patients suffering from diabetes. So as I said before, diabetes is #1 cause to develop chronic renal failure in the long run, and most of the patients on dialysis or most of the patients undergoing kidney transplantation, they are suffering from diabetes. So diabetes is the commonest cause for chronic kidney disease in India. All those patients who are suffering from diabetes must annually do their simple screening test for the kidney disease. There are two tests. One is urine routine test, which detects amount of protein going out into the urine, and a serum creatinine test or estimated GFR test. These tests should be done annually in patients suffering from diabetes, type 2 diabetes, after 10 years of diabetes. And if you notice any abnormalities in these tests, then you must visit a nephrologist, because when diagnosed in earlier stages, these diabetic kidney disease is preventable and is treatable. These patients are required, they need to take certain dietary precautions, they need salt restriction in the diet, they need some amount of protein restriction, and they need to control their blood sugar and blood pressure very accurately. So we are looking at hemoglobin A1C targets of less than 7%. We are looking at the blood pressure targets of less than 130/80, especially those patients who are having a protein loss in the urine, or those patients whose creatinine levels are elevated. So dietary restrictions, blood pressure control, blood sugar control, and there are another group of medicines which help to protect your kidneys. The class of these medications are, one is ACE inhibitors or ARB. So these are the medicines which control blood pressure, which control the protein loss in the urine, and they protect your kidneys in the longer run. The second class of drugs is the sugar lowering drugs called SGLT2 inhibitors. The examples being dapagliflozin or empagliflozin. Now these drugs are routinely available in India, and if used judiciously, they help to protect your kidney function in the long run. So it's my earnest request to all those patients suffering from diabetes, please screen your kidneys annually with simple blood and urine test, and if you notice any abnormalities, please visit your physician or a nephrologist. If you need any more information about diabetes and kidney disease, please visit my website, or you're free to contact the numbers mentioned below. Thank you.